Thank you, Dr. Ryan, for your question. I absolutely understand. I also understand the value of it's really been happening, because then it will be able to bring a lot of great values to a lot of people, and also allowing the professionals to practice around the countries in South Asia. Like you mentioned, the telemedicine is a great one of the great approach too, but I'm still thinking that moving around to one professionals to be providing care even without any telemedicine, but also bringing the right care and bring it to a collaboration platform for everyone to be connected. There are a few 10 things need to be done. So I'm going to go through in this video by answering your questions. So first of all, I like to say this one, even it's a thinking out loud idea, but I think it's very much possible. And to make it really happen, these are the 10 key things need to be happening moving forward. And if these 10 things happens, this collaborative regional platform of collaboration of providing care on top of a telemedicine will be providing. I mean, right now there's a few organizations providing telemedicine, but what is happening, it's a very small part of what it can be done. And you absolutely articulated that point of questions through your question, that point of benefits in your questions too. So let me go by one.
After working like last 15 years in IT field, this is what I realized. What is IT? Yeah. Sure. Make it happen. Thank you. So let's give a big hand to the student leaders to bring the training to you. Why don't you give a big hand to them?
So number one thing need to be done is a proper leadership initiatives. This is a great idea, but I've been to so many conferences the last 2-3 years of time in different conferences in about healthcare and telemedicine, but hardly someone was saying about building that kind of platform where to connect every medical professionals and allowing all those medical professions to different country. So an initiative is needed as well too, and somebody really need to put a lot of commitment to make it forward, because it's something, innovative ideas always takes a lot of effort. I'm really glad that Dr. Ran, you asking that question. I would love to see that if you really take the initiatives and show it to different conferences, come over and present. If there's one person would definitely be supporting your idea is me. If I'm there sitting down in the conference, I will definitely raise my hand and I will support you on this. That's the thing I can assure you today in my answer in this video. Number two is need to be done as you wanted to have the professionals to practice outside the countries in different other countries. So there is need to be a dialogue need to be happening G2G side, because otherwise having a proper G2G conversion and conversations, if it's not been done, the professionals will not have all kind of related support to do and practicing outside. Even there is some of the government considering about limiting their the telemedicine in platform without having the right compliance, because there's a few of the issues came over, like some of the patients had not appreciating experience having a telemedicine service from outside the country, and the government doesn't know how to really regulate that one. So if you can provide the right package, right modules to cover the G2G side, dialogue can be done, and everybody's willing to sign off a particular regulations and compliance to be done, then it's very much as possible. But however, to start with this one, start with 2 countries. There is a few top countries like Singapore, Thailand, and also probably Malaysia is one of the 3 countries has the top healthcare service provider in South Asia. If you could start with these 3, and if you could group them together, and if you start with a unified platform with these 3 in the beginning, then the rest will be a matter of exposure to come on board. There is every of the countries are in ASEAN group, so definitely if you could bring up this to ASEAN group conference in the next conventions, and definitely that could be a great wind of this idea. And number 3, end of the day, as you want to build a collaboration platform, you also need a great technology partner as well to build a platform, because it will not be easy to connect all the medical professionals by in a manual way. So need a technology platform to do it happen, and to build the right technology platform, and a proper technology platform need to be partnered with that one too. So, and that will only happen when you build the right service model and business model of this platform, how it will sustain itself. If it is a non-profit or for-profit, everything needs to be articulated as well too. Without articulating all this thing, if you go for partnerships, is not going to be real value, and not a right partner will be partnering with you too. This is the success booster card time. So question of the day: what is your key takeaway of this video so far? Go ahead and comment below the answer. We'll love to see what is the key takeaway. Science said that when you take up a key takeaway and note it down somewhere, you had a 35% chance to be actually doing it in your life to make it value out of it, which is amazing, right? But hang on, 35% is not enough. You need more, and this is the way I'm going to tell you how you can really make it happen. When you make a set of action, a plan that goes to from 35 to 91%, you can really make it happen in your life. So here we go. So from the key takeaway, what is the key action plan you're going to take, which is you learn from the video to your life, make a plan and commit it in publicly and commit into it. And that's what's going to make sure that you got 91% read that is going to really happen to you. Will be able to make it happen and become successfully achieve your goal. And here's the last possible hack. When you announce something, a plan publicly, your 91% goes to 94% to really make it happen in the real life. So go ahead and comment below your plan in the video sections. We would love to see your plan, and we are 100% reply every comments in our channel. So we're going to see your plan, we're going to comment it, we're going to give you a feedback, and we're going to consult you to help you to make your plan to a reality. And that can go to up to 100% reality happens to your life. And that's how you get your action, key takeaway to action plan to success to your life. And you know what? We're also sitting down here to help you and celebrate your success with you. So what are you waiting for? Let's go back to the video, finish it, and we're looking forward to see your action plan. And let's make it happen to your life, because you can do that, right? All the best. Don't forget to make your plan, okay? Don't forget to make your plan. See you soon. Number 4, POC implementation will be really crucial. Build a 1 or 2 countries together. If you could do 3, like I mentioned, 3 countries, and build a platform, and not just only concept, get them buy-in with an MVP product or platform developed, and then bring them, and probably 3 or 4 cities or few hundred doctors from different countries could bring it on together. And that POC or MVP can really help that leader to convince a different G2G conversation about to get a really fruitful discussions with the right example, right tool on the forward, and that can help the leaders, if you are leading this project, can really get it convinced as well too. Number 5, healthcare service provider. Well, this is one of the key initiatives can be done. A healthcare service provider who has a big presence in one country. If you can come up with the really great ideas to connect with other health professionals to share your resources, medical care or knowledges to support each other, could have come from different specialties, could come from focusing on different segments, like in one is targeting middle class, another one is targeting the top 1%. Then you are not overlapping each other. So if you could partner in this one, both can get facilitated to drive this thing forward and generate more extra revenues on your particular customer segment in your country. Number 6, the hospital chain who already have a global presence. There are some few hospitals in Singapore and also in Thailand. They have a global presence. So as you already have a global presence, if you could bring up a POC model for facilitating your already staff and medical professionals who are in different hospitals in different cities of different countries, and you can build up a proper one platform to do a POC, and that can show you that it's actually can bring values and what can provide to the community or passions or professionals. And then there could be a large amount of acquisitions of other hospitals to join the platform to share the value as well and contribute at the same time. Number 7, build a proper telemedicine platform. Currently, there is no unified telemedicine platform. It could be one of the features of the whole unified platform, but it could, at the same time, this telemedicine platform could be the first step to build it on, because right now there's a here and there different healthcare provider has different kind of telemedicine platform, and some are even running in Google, some are running in Zoom, and some are running in Microsoft Teams. So that's not a telemedicine platform. That's a very public platform, and data could be vague and could be lost or could be exposed. So in that thought, if you could build up a unified telemedicine platform which is specifically for healthcare and it follows certain criteria and compliance and what the video conversations or each of the conversation or the data will be used in the platform, how it will be stored and protected, could be a great opportunity which can leverage to this international regional healthcare practitioners platform as well too. Number 8, group CIO. So this could be in here, could be very helpful. So every these big countries, different countries of South Asia, they have different kind of top CIOs. One of the great ideas is to building all of them together in one place. So they are consolidating together and having a right brainstorming session to build up a business model and service model using the data to build a platform to facilitate all of them. But here is the point is really important. As you're bringing different countries, different companies, healthcare service provider chains, CIOs on the boards, it's very important that what will be their contributions and what will be the service model and what will be the return of investment of putting the time into this platform will be very crucial as well too. Number 9, the group CMO initiative. That will be also could be very important to bring all these different CMOs of different healthcare provider chains to put it together, put in the one table and discussing about what the business model will be, what are the things they will need to contribute and what they will get back in return as well, and also for the business they're working on as well, or hospital they're working on too. That need to be constructed as well. That has been properly been constructed, there will be definitely another great opportunity to make this a reality as well, this idea. Number 10, investment. There will be definitely a good amount of requirement is needed of having the right investment, which is resource, time, and also money too. If the resource and time is available, but money is not available, this platform will never go through. So somebody has such kind of investment idea with the time and resource and skills, both need to be put together and drive this initiative. And there is a way of being an entrepreneur, go and find the resource on the way, but this is quite a big initiative. So at least some sort of initiative fund need to be already ready on the ground and to go forward. And because some people really need to put really their strong effort to build such kind of platform. And to do that one of the key things you need to build about a service model and business model of this whole solution. So Dr. Ryan, here we go. I gave you 10 ideas which you really need to do and 10 aspects which you can use it to build such kind of platform for South Asia. I mean, here we go. I give you the ideas and how you can make it happen. It's your idea. I would love to see that if you really take actions and can build such kind of platform. Like I told you that if no one supports you in the conference, if you're presenting this one and I'm there, I will definitely raise my hand and will support you, Dr. Ryan. So all the best. It's such a great initiative and great idea. And here's my support from bottom of my heart to give you the 10 tips to make it happen. All the best.